Intro and amp, hook. You've waited those agonizing 3 minutes. You pick up the test, and your heart does a little flip. There's a line, but it's faint. So faint you're wondering if your eyes are playing tricks on you. What does that even mean? Are you pregnant or not? That dizzying mix of hope and confusion is completely normal, but right now, you just want a clear answer. In the next few minutes, we are going to decode what that faint line is telling you, go over the common reasons it happens, and most importantly, tell you the single most important next step to take to know for sure. Section 1. The most likely answer is yes. Let's cut right to the chase. A faint line on a pregnancy test almost always means you're pregnant. Here's why. Home pregnancy tests are made to look for one specific thing, the pregnancy hormone, called human chorionic gonadotropin, or HCG. Your body only starts making this hormone after a fertilized egg has snuggled into your uterine lining. So, any kind of colored line, no matter how light, means the test has found HCG in your urine. The main reason a line would be faint is that your HCG levels are still low, which is super common if you test very early in your pregnancy. In a healthy pregnancy, those HCG levels rise fast, usually doubling every 2 to 3 days. So, think of that faint line as your body's first whisper of the big news. Section 2. But what about an evaporation line? Now, we have to talk about the number one cause of confusion, the evaporation line. This is the imposter that can look like a faint positive, but isn't. An evaporation line is a faint, colorless mark that can show up on a test as the urine on it dries. So, how can you tell them apart? It really comes down to two things, timing and color. A true positive line, even a faint one, will show up within the test's recommended time, usually 3 to 5 minutes. An evaporation line appears after that window has closed, sometimes 10 minutes or more later. And here's the biggest giveaway, color. A real positive line will have some color to it, usually pink or blue, just like the control line. An evaporation line is typically colorless, gray, or just looks like a shiny little dent where the dye should be. If the line you're seeing showed up on time and has any hint of color, it's not an evaporation line. Section 3. Other factors to consider while testing early and evaporation lines are the two main culprits. A couple of other things can lead to a faint result. First, your urine might be too diluted. If you've been drinking a ton of water or you tested later in the day, the HCG in your urine can get watered down, leading to a fainter line. This is why most tests suggest using your first morning urine, which is the most concentrated. Second, and this is a sensitive topic, is the possibility of what's called a chemical pregnancy. This is a very early pregnancy loss that happens shortly after the embryo implants. The body produces just enough HCG to be picked up by a test as a faint line, but the pregnancy doesn't continue to develop. Often, the line won't get any darker on later tests, and you'll get what seems like a normal period. It's important to know that these are very common, and most people who have one go on to have healthy pregnancies. CTA, the single most important next step. So, with all these possibilities, what should you do right now? It's simple, wait 48 hours and test again. Like we said, HCG levels are supposed to double every couple of days in early pregnancy. By retesting after 48 hours, you give your body time to produce more of that hormone. If you are pregnant, the line on that second test should be noticeably darker and more definite. For the most reliable result, use your first morning pee and a brand new test, and make sure to follow the instructions to the letter. Conclusion: to wrap it all up, in most cases, a faint line that has color and shows up in the right time frame means you are pregnant. The faintness is usually just a sign that you are testing very early. But, you have to be careful not to confuse it with a colorless evaporation line that shows up late. Your best bet is to wait 2 days and test again to see if that line gets darker. But no matter what your next home test shows, the best way to confirm everything is to make an appointment with your doctor. They can do a blood test to measure your exact HCG levels or schedule an ultrasound to officially confirm the pregnancy. If this helped clear things up, consider subscribing for more straightforward health answers. And if you're comfortable, sharing your experience in the comments can be a huge help to others who are staring at their own faint line right now. Above all, remember to be kind to yourself during this time of uncertainty.